Cutaneous innervations of upper limb. Introduction. Cutaneous innervation refers to the innervation of the skin. The fascia after the reflection of skin contains the cutaneous nerves and vessels. These nerves carry sensory and motor impulses from and to the area it innervates. Superficial veins are also seen along with the cutaneous nerves. Cutaneous nerves. The skin of the upper limb is supplied by 15 sets of the cutaneous nerves. Out of these, one set, that is supraclavicular, is derived from cervical plexus, and second set, that is intercostobrachial, which is derived from the second intercostal nerve. The remaining 13 sets are derived from brachial plexus through the musculocutaneous, median, ulnar, axillary and radial nerves. Some branches arise directly from medial cord of the plexus. The areas of distribution of peripheral cutaneous nerves do not necessarily correspond with those of the individual spinal segments or dermatomes. Adjacent areas of skin supplied by different cutaneous nerves overlap each other to a considerable extent. The nerves of the anterior surface have a wider area of distribution than those supplying the posterior surface. The individual cutaneous nerves from above downwards are described with their root values. Supraclavicular nerves. The supraclavicular nerves are descending branches of C3, C4. Course emerges from beneath the posterior border of the sternocleidomastoid muscle, descend in the posterior triangle of the neck beneath the platysma and deep cervical fascia. Branches. Near the clavicle, they perforate the fascia and platysma to become cutaneous and are arranged according to their position into three groups: anterior, middle, posterior. Anterior supraclavicular nerve. The anterior, also called as medial supraclavicular nerves, cross obliquely over the external jugular vein and the clavicular and sternal heads of the sternocleidomastoid. It supplies the skin as far as the middle line and second rib inferiorly. Middle supraclavicular nerve. The middle supraclavicular nerve, also called as intermedial supraclavicular nerve, cross the clavicle and supply the skin over the pectoralis major and deltoid, communicating with the cutaneous branches of the upper intercostal nerves. Posterior supraclavicular nerve. The posterior, also called as lateral supraclavicular nerve, pass obliquely across the outer surface of the trapezius and the acromion and supply the skin of the upper and posterior parts of the shoulder. Superior lateral cutaneous nerve of arm. Origin. The superior lateral cutaneous nerve of arm, C5, C6, or superior lateral brachial cutaneous nerve, is the continuation of the axillary nerve of the posterior cord after it pierces the deep fascia. Course. Then passing through quadrangular space, it sweeps around the posterior margin of the deltoid muscle and supplies the skin over the lower 2/3 of the posterior part of this muscle, as well as that covering the long head of the triceps brachii, and supplies the skin over the superolateral part of arm. Inferior lateral cutaneous nerve of arm. Inferior lateral cutaneous nerve of arm, C5, C6, also called the inferior lateral brachial cutaneous nerve. It is the branch of the radial nerve that provides sensory and vasomotor innervation to the lower lateral aspect of the arm. Intercostobrachial nerve. Origin. The intercostobrachial nerve, T2, is lateral cutaneous branches of the second intercostal nerve. The lateral cutaneous branch of the second intercostal nerve does not divide like the others into an anterior and posterior branch. It then pierces the fascia and supplies the skin of the upper half of the medial and posterior part of the arm. It is often the source of referred cardiac pain. Medial cutaneous nerve of arm. The medial cutaneous nerve of arm, also known as medial brachial cutaneous nerve, is distributed to the skin on the medial brachial side of the arm. Origin. It is the smallest branch of the brachial plexus and arising from the medial cord of brachial plexus. Course. It passes through the axilla, at first lying behind, and then medial to the axillary vein, and communicates with the intercostobrachial nerve. It descends along the medial side of the brachial artery to the middle of the arm, where it pierces the deep fascia. And it is distributed to the skin of medial surface and posterior of the lower third of the arm, extending as far as the elbow, where some filaments are lost in the skin in front of the medial epicondyle and others over the olecranon. Eponym. The term nerve of Risberg after Heinrich August Risberg has been used to describe this nerve. Posterior cutaneous nerve of arm. The posterior cutaneous nerve of arm, also known as posterior brachial cutaneous nerve. Origin. It originates from the radial nerve in the axilla that provides sensory innervation for much of the skin on the back of the arm. It is of small size. Course. It passes through the axilla to the medial side of the area, supplying the skin on its dorsal surface nearly as far as the olecranon. In its course, it communicates with the inferior lateral cutaneous nerve of arm, crosses behind, penetrates through the lateral head of triceps brachii muscle, and overlying deep fascia to become subcutaneous. Lateral cutaneous nerve of forearm. The lateral cutaneous nerve of forearm, also known as lateral antebrachial cutaneous nerve. Origin. It is branch of muscular cutaneous nerve. Course. It passes behind the cephalic vein and divides opposite the elbow joint into a volar and a dorsal branch. The volar branch named as ramus volaris, which is anterior branch. Course. It descends along the radial border of the forearm to the wrist and supplies the skin over the lateral half of its palmar surface. At the wrist joint, it is placed in front of the radial artery and some filaments piercing the deep fascia accompany that vessel to the dorsal surface of the carpus. The nerve then passes downward to the ball of the thumb, where it ends in cutaneous filaments. It communicates with the superficial branch of the radial nerve and with the palmar cutaneous branch of the median nerve. The dorsal branch, ramus dorsalis, posterior branch, descends along the dorsal surface of the radial side of the forearm to the wrist. It supplies the skin of the lower two-thirds of the dorsolateral surface of the forearm, communicating with the superficial branch of the radial nerve and the dorsal antebrachial cutaneous branch of the radial. Medial cutaneous nerve of forearm. The medial cutaneous nerve of forearm, also known as medial antebrachial cutaneous nerve, internal cutaneous nerve. Origin. It arises from the medial cord of the brachial plexus of root value C8 and T1. Course. Its commencement is placed medial to the axillary artery. The nerve then runs down the ulnar side of the arm medial to the brachial artery, pierces the deep fascia with the basilic vein about the middle of the arm, and divides into a volar and an ulnar branch. The volar branch, ramus volaris, anterior branch, the larger descends on the front of the ulnar side of the forearm, distributing filaments to the skin as far as the wrist. The ulnar branch, ramus ulnaris, posterior branch, passes obliquely downward on the medial side of the basilic vein in front of the medial epicondyle of the humerus to the back of the forearm and descends on its ulnar side as far as the wrist, distributing filaments to the skin. Posterior cutaneous nerve of forearm. The posterior cutaneous nerve of forearm, also known as the dorsal antebrachial cutaneous nerve, the external cutaneous branch of the musculospiral nerve, posterior antebrachial cutaneous nerve. Origin. It arises from the radial nerve in the posterior compartment of the arm, often along with the posterior cutaneous nerve of the arm. Course. It perforates the lateral head of the triceps brachii muscle at the triceps attachment to the humerus. The upper and smaller branch of the nerve passes to the front of the elbow, lying close to the cephalic vein, and supplies the skin of the lower half of the arm. The lower descends along the lateral side of the arm and elbow, and then along the back of the forearm to the wrist, supplying the skin in its course. Median nerve. The palmar cutaneous branch of the median nerve arises at the distal part of the forearm. It pierces the palmar carpal ligament and supplies sensory innervation to the lateral aspect of the skin of the palm, but not the digits. Digital cutaneous branches to common palmar digital branch and proper palmar digital branch laterally 3.5 digits of the palmar side, dorsum of the tips of index, middle and thumb. Superficial branch of ulnar nerve. Origin. The superficial branch of the ulnar nerve is the terminal branch of the ulnar nerve. It supplies the skin on the ulnar side of the hand. Course. It divides into a common palmar digital nerve and proper palmar digital nerve. The proper digital branches are distributed to the fingers in the same manner as those of the median nerve. Superficial branch of the radial nerve. Origin. The superficial branch of the radial nerve is one of the terminal branches of radial nerve. Course. It passes along the front of the radial side of the forearm to supply its lower third. It lies at first slightly lateral to the radial artery, concealed beneath the brachioradialis. In the middle third of the forearm, it lies behind the same muscle, close to the lateral side of the artery. It quits the artery about 7 cm above the wrist, passes beneath the tendon of the brachioradialis, and, piercing the deep fascia, divides into 2 branches, lateral and medial. Lateral branch. The lateral branch, the smaller, supplies the radial side of the thumb, the skin of the radial side, and ball of the thumb. Medial branch. medial branch divides into 4 digital nerves, which are distributed as follows. The first supplies the ulnar side of the thumb. The second, the radial side of the index finger. The third, the adjoining sides of the index and middle fingers. The fourth supplies the adjacent sides of the middle and ring fingers. Cutaneous veins. Superficial veins give the parenteral axis and hence gain the utmost importance. Most of these small ones join together to form 2 large veins of the upper limbs, that is, cephalic vein and basilic vein. A very amazing fact about these vessels is that they are not present in the pressure points such as the palm, ulnar border of the forearm, back of the arm. Hence, they move in a spiral course. The load of the cephalic vein is greatly relieved by the basilic vein through a short circuiting channel and partly also by the deep veins through a perforator vein connecting the median cubital to the deep vein. Superficial veins are best utilized for intravenous injections and to draw blood for diagnostic tests. Dorsal venous arc. It lies on the dorsum of the hand and branches into 3 dorsal metacarpal veins, a dorsal digital vein from the medial side of the little finger, a dorsal digital vein from the radial side of the index finger, 2 dorsal digital veins from the thumb. The efferents of dorsal venous arc are the cephalic and basilic vein. Cephalic vein. Cephalic vein is the preaxial vein of the upper limb. It begins from the lateral end of the dorsal venous arc and runs upwards through the roof of the anatomical snuff box, winding around the lateral border of the distal part of the forearm, and continues upwards in front of the elbow and along the lateral border of the biceps brachii. Then it pierces the deep fascia at the lower border of the pectoralis major, runs in the delta pectoral groove up to the infraclavicular fossa and pierces the clavipectoral fascia and joins the axillary vein. At the elbow, a greater part of the blood is drained into the basilic vein through the median cubital vein. Cephalic vein is accompanied by the lateral cutaneous nerve of the forearm and the distal part of the radial nerve. Basilic vein. Basilic vein is the postaxial vein of the upper limb. It begins from the medial end of dorsal venous arc forearm and runs upwards along the medial border and winds around this border and continues upward in front of the elbow and along the medial margin of biceps brachii up to the middle of the arm, pierces the deep fascia and runs along the medial border of the brachial artery up to the lower border of teres major, where it becomes the axillary vein. Basilic vein is accompanied by the posterior branch of the medial cutaneous nerve of the forearm and the terminal part of the dorsal branch of ulnar nerve. Median cubital vein. It is the largest communicating vein that shunts the blood from the cephalic vein to the basilic vein. It begins from the cephalic vein 2.5 cm below the bend of the elbow and runs obliquely upward and medially and ends in basilic vein above the medial epicondyle. Median vein of the forearm. Median vein of the forearm begins from the palmar venous network and ends in any one of the veins in front of the elbow, mostly in the median cubital vein.